My name is Needham, and I am currently in my 4th year of the James Cook University Bachelor of Dental Surgery program, and today I am presenting on behalf of my student research group. Our research explores the perceived preparedness of JCU BDS students to preempt, identify, and manage medical emergencies in a clinical setting following a dental simulated emergency medical training program, which will be referred to as DSEMT for short. Before getting into our research, I will first deliver some background information on its relevance. Increasing medical advancements coincide with increased life expectancy, leading to an aging population with a higher proportion of medically compromised patients. This is because a longer life expectancy results in a physiological decline, which increases the incidence of disease and comorbidities. This accounts for the increased likelihood of a medical emergency occurring during dental treatment. In addition to comorbidities, many triggers of medical emergencies exist in the dental setting, including patient anxiety, local anesthetic administration, and adverse reactions to certain dental materials. Because of this, it is crucial that dental professionals have the skills to adequately preempt, identify, and manage medical emergencies, as is expected of them by community and professional bodies. Additionally, most JCU BDS students are placed in rural and remote placements in their final year. Rural and remote placements tend to have fewer skilled personnel to manage the burden of chronic disease and resulting higher proportion of medically compromised patients. There are also difficulties in accessing resources, a shortage of healthcare facilities, and reduced professional support from other disciplines. Therefore, there is an increased likelihood that students will have more responsibility in managing medical emergencies in the dental setting. This is further supported by anecdotal accounts we have received from students currently on their final year of placement. Moreover, the professional competencies for a newly graduated dentist requires that upon graduation, a dentist must be able to manage medical emergencies. Studies have identified that even following emergency training and lectures, students still self-report a lack of confidence and in some cases are unable to competently manage medical emergencies even under supervision. One particular study suggests that many dentists upon graduation do not feel adequately prepared to manage real-life medical emergencies, which likely reflects a deficit in the curriculum. As such, it is crucial to ensure a curriculum which best prepares students to manage clinical emergency situations. To enable graduates who are capable of preempting, identifying, and managing medical emergencies, James Cook University delivers authentic, high-fidelity, scenario-based simulations in the dental setting. JCU dental students start clinic in their 3rd year. Hence, DSEMT comprises of small groups of year 3, 4, and 5 students participating in hands-on workshop sessions within the clinical setting. These are delivered by emergency nurses who simulate patients experiencing medical emergencies during a dental procedure, creating an authentic, high-fidelity workshop for students in their clinical years. Our research seeks to determine the efficacy of DSEMT in preparing dental students for preempting, identifying, and managing medical emergencies by exploring the perceptions of 4th and 5th year JCU BDS students on their level of preparedness. The results of the study can be used to provide evidence-based research that informs the JCU BDS medical emergency training, allowing for more competent graduates. After obtaining ethics approval, our mixed methods participatory action research project was conducted in 3 stages. The first stage focused on exploration, identification, and documentation of JCU BDS students' perceived preparedness in managing a medical emergency within the clinical setting. This was assessed prior to DSEMT delivery using a survey. The second stage reassessed the perceived preparedness in managing medical emergencies after undergoing DSEMT. This was conducted to assess the value of the training, again through a survey, which was given at the end of the DSEMP session. The third stage identified perceived preparedness in managing a medical emergency after fourth-year objective structural clinical exam, also known as OSCE, or after a semester of external fifth-year clinical placement. As the curriculum for Year 4 and Year 5 differs, particularly in terms of location, the three surveys catered to each year to account for these differences. The surveys included Likert scales, which were then converted into a numerical value which demonstrated the felt preparedness of the students. In addition to the two surveys, two focus groups were also conducted with each year level, which allowed for qualitative results to be collected. Thematic analysis was used to analyze the qualitative data gathered from the focus groups, while a statistical software was used to analyze the summary and descriptive quantitative data using t-tests and cross-tabulation across fourth and fifth year survey results. The results of our statistical and thematic analysis revealed that overall DSEMP is effective in preparing dental students in preempting, identifying, and managing medical emergencies in the dental setting. Our statistical analysis showed that the level of perceived preparedness of fifth-year students directly following DSEMP was significantly greater than that prior to the session. However, this preparedness following external clinical placement was significantly lower than directly after DSEMP. The level of perceived preparedness of fourth-year students was also significantly greater following DSEMP. However, there was no significant difference in the felt preparedness following DSEMP and post-OSCE. Fifth-year students participated in focus groups following a semester of clinical placement. The data from focus groups revealed that students felt more prepared to identify and manage a medical emergency following DSEMP. Students believed that DSEMP was the most effective way, compared to lectures and workshops, to develop skills in identifying and managing medical emergencies. However, previous knowledge acquired in lectures and workshops was still beneficial as it provided students with the opportunity to implement this knowledge in a practical setting. Many students favored DSEMP's realistic acting, wide range of scenarios in the clinical setting it was delivered in. Furthermore, the repeated exposure to DSEMP allowed solidification of key concepts. Fifth-year students found that DSEMP influenced their clinical practice as it allowed them to preempt medical emergencies. The training improved their medical history taking, enabled them to recognize at-risk patients, and know when to delay treatment. Additionally, those students who encountered a medical emergency whilst on placement felt that DSEMP prepared them to remain calm and instinctively recall management tactics, resulting in an effective management of the situation. Focus groups participated in by fourth-year students following their OSCE reiterated and expanded upon the data from the fifth-year focus groups. Fourth-year students agreed that DSEMP was the most effective way to prepare for medical emergencies and taught them to remain calm and use a methodical approach. Their views on the positive aspects of DSEMP correlated with that of the fifth years, with the addition that they also valued learning how to use emergency equipment. Additionally, simulated training enabled them to discover their likely reaction in a real-life medical emergency, allowing them to rectify any unfavorable initial reactions. Fourth-year students who had experienced medical emergencies during clinical practice agreed that DSEMP provided them with the knowledge to diagnose and manage the situation appropriately. They were also more comfortable to make decisions and give instructions. While both fourth and fifth-year students were overall satisfied with the delivery of DSEMP, they felt that having smaller groups would enhance their experience. Additionally, they agreed that having more DSEMP sessions at regular intervals throughout the semester would reiterate knowledge and increase retention of important concepts. With increased risk of a medical emergency during dental treatment due to more medically compromised patients, it is important for dental universities to produce competent graduates that can adequately preempt, identify, and manage medical emergencies. James Cook University delivers DSEMT as part of their BDS curriculum to improve the preparedness of undergraduate dental students in managing medical emergencies in a clinical setting. This is especially important for JCU, as dental students at JCU are often placed in rural and remote placements. With fewer resources and health professionals in these areas, dental students could be more responsible in managing a medical emergency. Previous studies suggest that students are not confident and sometimes cannot competently manage a medical emergency after emergency medical training and lectures. However, the results obtained from both statistical and thematic analysis in this study support how advantageous DSEMT is and how well it prepares dental students to preempt, identify, and manage medical emergencies. By including the DSEMT program in the JCU BDS curriculum, JCU is aiming to better prepare dental students when facing a medical emergency. Both statistical analysis and focus group themes demonstrate that 4th and 5th year students felt significantly more prepared to manage a medical emergency after DSEMT. However, after a semester of external clinical placement, the 5th year's preparedness was reduced, while the 4th years did not describe a difference in preparedness post-OSCE. The difference in preparedness between 4th and 5th year students may be attributed to the different frequency and time spent between DSEMT sessions. This creates a limitation in the study, as the 4th years were introduced to DSEMT earlier in their clinical years and had an additional refresher session in comparison to the 5th years. Therefore, a follow-up study should be conducted where both the 4th and 5th year students were introduced in their 3rd year to DSEMT to ensure that there is no bias. Another limitation was not being able to survey the entire 4th and 5th year cohorts, resulting in possible generalization. Moreover, there were different emergency simulation educators depending on which group the students were in, which could impact the students' learning experience. While students express interest in multiple DSEMT sessions in smaller groups, this may not be feasible in the JCU BDS curriculum due to costs and availability of emergency simulation educators. Regardless, students were generally content with the DSEMT program. Many students praise DSEMT for its authentic and scenario-based simulations in a dental setting, which suggests that DSEMT would also be useful in other dental schools. By implementing DSEMT in other BDS curriculums, more dental students can familiarize themselves with how to manage a medical emergency in a dental setting, increasing the number of competent graduates. This research project will also be presented at the Australian Public Health Conference, the Crana Plus Conference, the CHHS Research and Quality Symposium, and JCU Clinical Day in November 2018. There is also potential for the data from this research project to be used in research publications and reports such as rural and remote health-based peer-reviewed journals. Dental professionals should be able to competently preempt, identify, and manage medical emergencies in a clinical setting. This research shows that DSEMT is an authentic, high-fidelity workshop that prepares undergraduate dental students to respond effectively to medical emergencies when practicing in diverse regional, rural, and remote contexts. From the success of DSEMT at JCU, DSEMT is likely to be beneficial if incorporated in other dental university curriculums. We would like to thank our supervisors, Dr. Felicity Croker and Mr. Luke Croker, for their continual guidance throughout this research project, as well as the emergency educators at Cairns Base Hospital and the participating students. Thank you.